Mississippi. We are live from Mississippi State University for Children's Advocacy Centers of Mississippi. We welcome to the program Karla Tye, the Executive Director of Children's Advocacy Centers of Mississippi. Karla, good to see you. Thanks for coming on.
Thank you for having me.
All right, so tell us about the Children's Advocacy Centers of Mississippi. What's the mission of the organization?
We are working to defeat child abuse across the state. We have 11 child advocacy centers from North Mississippi down to the coast that are working to respond to children after they've been victims of felony-level child abuse. So they provide a number of services to help them heal.
And the folks that work for the child advocacy centers, how do they get trained in order to help these children?
So through our organization, we provide a number of trainings for forensic interviewers, victim advocates, for therapists, the whole gamut. And then over the last few years, we've really been focusing on working with our colleges and universities to implement child advocacy studies. So we're moving upstream to prepare our future workforce.
Yeah, we're going to be talking to some representatives today from the colleges. So is this part of like the social worker programs, or how does that training fit into the curriculum?
Well, what's key is that it's interdisciplinary. So what we know is on the front line, you have law enforcement working with social workers, working with physicians, with prosecutors. So they have to learn to talk to each other, communicate the same language. They need to know each other's laws, their policies, how to work together as a team, because child abuse is quite a complex issue to respond to. And so what we want is to replicate that on the college level so that you have criminal justice majors taking courses with social work majors, with faith studies. So it is truly an interdisciplinary approach.
Reading some of the statistics here, nearly 8,837 child abuse victims received services at a center. That's a lot.
Just last year.
That's disturbing. How do you find out about these children? How do they come in to work with you guys?
So we receive referrals from law enforcement, child protective services, the FBI, from the Attorney General's office. So it has to be an agency that is involved in the investigation of child abuse.
Okay. And so then do they contact your organization and say, look, we found a situation you guys need to know about, you get involved?
Absolutely. So they make a referral to the local child advocacy center, and that's when everything springs into action. And we will conduct, typically the front door that most people think about is the forensic interview. And so the child's referred, and law enforcement, child protective services are there observing the interview at that time. And we have trained forensic interviewers on staff at the child advocacy centers that interview the child in a non-leaning, non-suggestive manner about that abuse allegation.
Okay. So the concern I would have, Karla, is what about the cases we don't know about? I got to believe there's a lot of those. How does law enforcement even find out? Do the children just finally figure out a way to get word to somebody that they believe can help them in the situation?
It really depends on the situation, but we often have intentional disclosures where children make a report. They learn something, this is not right, or they're uncomfortable. They've received someone's asked them, maybe they've seen some signs or symptoms of abuse, and so they make a disclosure. Then there's oftentimes spontaneous disclosures or accidental disclosures where someone may walk in or see something, suspect something. But everybody in our state is a mandated reporter. So we may have a teacher. We know that schools are the location where a lot of our kids make a disclosure because they have a teacher that they trust, or a teacher may see those signs and symptoms, and so they report that to law enforcement or child protective services.
Or like in the case of teachers, which of course have more interaction arguably with children than anybody else. They're going to come in contact with them, short of the family environment. Are they compelled by law to report these situations? Is there laws on the books in Mississippi that require them to notify somebody when they suspect something? Is it foul?
Every citizen is required is a mandated reporter in our state. So you and I, if we suspected abuse from our neighbor or somebody we saw in the grocery store, we are mandated by law to make that report.
Okay, so when you use the term mandated, you mean legally mandated?
Legally mandated. We are all reporters.
Not just an ethical or a moral mandate, but a legal mandate.
Absolutely.
Okay.
Under the law, we are all required to report. If we suspect, we, as it should be. Ethically, we should be willing to take care of children.
Sure. So what should we be looking for? What are the red flags?
Well, often it's going to be unexplained bruises, cuts. It may be a child who suddenly has become very withdrawn. Children may begin bedwetting or having accidents that are unexplained. Also, children may oftentimes will share a little bit about that abuse and kind of test the waters to see if that adult is a safe person to tell, and then later on we'll make a full disclosure.
Are there some common threads in a home environment that tend to lead to this sort of abuse of children?
Well, it's interesting, and I think when you're talking about sexual abuse and physical abuse, you're talking about two different things here. But with physical abuse, we saw a huge increase during the pandemic. Times of stress, and families were struggling with jobs and security, and then living in a close environment. Kids were no longer in schools and they were homeschooled. We saw those numbers skyrocket. So we know that stress in a family can really trigger that abuse. And then we also see just parenting that has gone to the extreme. Not knowing, not having been taught how to discipline a child without it going too far.
I see. Are there areas of the state or just community environments that tend to be more prone to child abuse than others, or is it just widespread, sort of random?
Crosses over every socioeconomic range. It impacts every culture. This is, unfortunately, child abuse does not discriminate.
Yeah. This is a national problem, too, is it not?
Absolutely. The CDC says that just 1 year's worth of cases cost us $124 billion.
Wow. So when your organization gets involved, what sort of action do you take? Do you remove the children from the home, place them in care elsewhere?
Well, and that's the role of Child Protective Services, and I know that they'll be here later on today. So the Child Advocacy Centers are really there to provide coordination among all the multidisciplinary team members, so law enforcement, social workers, prosecutors. They're there to interview the children and conduct those forensic interviews. They also provide victim advocacy services, because there's so many agencies that get involved, that families that don't know how to navigate the system. And they're there to work with those families on that, to be able to provide referrals for forensic medical, for the mental health, the appropriate therapist that should be seeing a child. So that's the role of the Child Advocacy Center. And we stay in our lane, and then Child Protective Services is the one who would get involved with the placement for the child. And as I say, this is why the Child Advocacy Studies is so critical, is for all of our future workforce to really understand those various disciplines.
So it sort of sounds like your organization maybe brings all these, you said interdisciplinary, which is a good way to describe it, but sort of serves as maybe the orchestrator of all the resources that you need to bring to bear to address these situations. Because it's not just one, it's not just law enforcement, it's not just social workers, it's not just physicians. You need them all in these cases.
Absolutely, and I think that's a great term for it. We're orchestrating that. We're really the one who's coordinating all of those different entities.
So we've talked about kind of the negative side, of course, of child abuse, and it is just abhorrent. Tell us about some successes you've had when you get involved.
Oh, there's so many successes. When we see that a child can come in, tell that story one time, not be re-traumatized by being tossed from agency to agency, get them in the appropriate services they need to help them heal from abuse. This does not have to be a life-defining event. This is something that has happened to them. They can heal from it and then move on and become just a happy, healthy citizen.
Once they sort of progress through age, do they come back and say, wow, I didn't realize what was going on. I see now. I'm so glad you guys got involved, and I'm on my way to being a productive, healthy adult?
We do, but I will say that typically is done more privately.
Okay.
We don't see a
Sure.
lot coming out.
Sure.
You don't hear a lot of celebrities coming out and saying,
Yeah,
"This was my
sure.
experience." Yes.
But you know it, though.
Yes,
you,
we do.
Yeah, you realize when that occurs. Well, we're glad that your organization exists. It's sad that it has to, honestly, but the children need a voice. They need an advocate, and it sounds like that's what it's the name of your organization. It's in your name. It's your brand. So we appreciate that. Thanks for coming on, Karla.
Appreciate it.
Yeah, we're stepping aside for a break right here.